Welcome to the physiology part of the Kaplan Medical Series, video series. I'm Dr. Robert B. Dunn. I've been a medical professor for 25 years, and I've been intimately involved in preparing students for Step 1 for the last 10 years. Now, the physiology notes have been divided into 10 sections, and we're going to start in Section 1, and Section 1 is simply a section labeled General Topics. We thought we would have some very simple material at the beginning, material that must be understood before we go into some of the other sections. Now, in terms of the first chapter here, the first chapter is membrane transport. And we start off with the generalized figure of a cell membrane. Now, the basic structure of a cell membrane is that of phospholipid. It is basically a bilayer of phospholipid molecules. The hydrophilic, the water-soluble end, is on the outside of the membrane, and the hydrophobic end, the lipid-soluble end, is in the interior of the membrane. Now, the dynamic aspects of the membrane are the protein structures of the membrane. We'll be interested in a few basic intrinsic proteins, such as channels, membrane transporters, and receptors. Now, the first process I want to consider here is simple diffusion. Boards does expect you to understand the processes involved in getting molecules across membranes, and if they ask you a question about diffusion, they usually ask you a question about the factors that affect the rate of diffusion. Now, by rate, I mean how fast the molecules are moving across the membrane. Now, all of the variables that affect rate are put into an equation. Now, we try and keep the equations to a minimum, but when necessary, they are introduced into the notes. You should not simply memorize these equations. Rather, it's important to understand the relationships then expressed in the membrane, and that's what we're interested in here. Simply the relationship shown by this membrane. Now, D here is how fast the molecules are moving across the membrane. D is the rate of diffusion. Now, all of the variables that affect rate are in this equation. Now, we start with the numerator. The first variable in the numerator is delta P. Now, delta P is the concentration gradient across the membrane. You should realize the greater the concentration gradient, the faster diffusion will proceed. And it is the concentration gradient that is driving the process of simple diffusion. Now, the second variable is surface area. Since it is also in the numerator then, the greater the surface area, the greater the rate of diffusion. For example, if an individual develops emphysema, you will lose surface area, and because you lose surface area, the rate of diffusion decreases. And the more surface area you lose, the slower the rate of diffusion. That is why, as you develop emphysema, the rate of oxygen and CO2 diffusion progressively decrease with time. On the other hand, if you exercise, you should realize you open up additional pulmonary capillaries, and the surface area for diffusion increases. And that is why during exercise then, oxygen and CO2 diffusion always increase the rate of exchange. Now, the third variable in the numerator is solubility. This specifically is the solubility of the substance in the membrane, or possibly the permeability of that membrane to that substance. And the main point here is the more soluble the substance in the membrane, the faster it will diffuse across the membrane. Now, in the lungs then, CO2 is a more soluble gas than oxygen. And because CO2 is more soluble, it always diffuses faster than oxygen. In fact, we can go one step further here. CO2 is the most soluble gas you will ever deal with clinically, and because of that, CO2 always diffuses faster across membranes than any other gas. So no matter what gas you're dealing with, CO2 always diffuses faster across membranes. Now, in the denominator, you have an inverse relationship, and the only variable that's important here is the thickness of the membrane system you're dealing with. Because it is an inverse relationship, the thicker the membrane system, the slower the rate of diffusion. A good example here is lung fibrosis. As you develop fibrosis, the lung membranes will thicken. And as they thicken, then, the rate of oxygen and CO2 diffusion decreases. The thicker the membrane system, the slower the rate of oxygen and CO2 diffusion. Now, there is another variable in the denominator. This is the molecular weight of the substance. This has no significance in the clinical situation, so will never be tested on step 1. Now, another smaller point here is to realize the molecules of each species will diffuse independently. There is no direct interaction among the molecules during simple diffusion. For example, if you're breathing room air, which contains 21% oxygen and 79% nitrogen, and you replace the nitrogen in that room air with helium. If you replace the nitrogen with helium, then that will not affect the oxygen and CO2 diffusion because each gas diffuses independently. So if you replace the nitrogen in the air you're normally breathing with another inert gas, it has no effect whatsoever in oxygen or CO2 diffusion. Now, another example, which is just a special case of simple diffusion, is osmosis. Now, you really have to understand exactly what is going on in osmosis. Now, as I said, osmosis is just a special case of simple diffusion. More specifically, osmosis is the simple diffusion of water across a semi-permeable membrane. Now, like any other substance, diffusion is always from a higher concentration to a lower concentration. Therefore, with osmosis, the water moves from a higher concentration of water to a lower concentration of water. Now, the key point here is what determines the concentration of water. And you should realize it is the solute. It is the dissolved solid that determines the concentration of water. More specifically, the higher the concentration of solute or salt, the lower the concentration of water in that solution. So what it is the concentration of the salt that determines the concentration of the water. Now, a standard way of testing this on step 1 is to show you this figure here. Now, this figure is a beaker containing fluid. On the left side, we have compartment A. On the right side, compartment B. And these two compartments are separated by a membrane system. The circles represent the dissolved solute. On the left side here, we have fewer circles, so this represents the lower concentration of salt. Because the salt is lower in concentration in compartment A has the higher concentration of water. Now, in B here, we have a higher concentration of salt, and therefore we have a lower concentration of water. Now, reading the stem here carefully, if the stem states that this membrane is permeable to water but not the salt, the water will move from the higher concentration of water, compartment A, into the lower concentration of water, which is compartment B. If that is the case, the height of compartment B will increase and the height of compartment A will decrease. Therefore, at equilibrium then, you'll have a lower column of fluid in compartment A and a higher column of fluid in compartment B. Now, every once in a while, they probably will change the stem to make it a slightly different question. Now, if they change the stem to something like this, we'll say, suppose they state that the membrane here is permeable to both water and salt. If the membrane is permeable to both water and salt, you should realize at equilibrium, in compartment A and compartment B, you would have the same concentrations of both water and salt. So at equilibrium then, the salt concentration is the same in the two compartments, and the water concentration would also be the same. More importantly, under these conditions then, the height of compartment A and the height of compartment B would be exactly the same. Now, this is a standard model to test your understanding of the basics of osmosis. Now, I do want to say a few things about units that we use to express the concentration of salt or solutes. The standard unit is milliosmolar. Sometimes it's expressed as milliosmoles per liter, but it can also be simply presented as shown here, and this is milliosmolar. This unit represents the concentration of individual particles in solution. So milliosmolar is the concentration of individual particles in solution. Now, the other unit they may use here is millimolar. And little m, big M is millimolar. This is the concentration of individual molecules in solution. So millimolar, sometimes millimoles per liter, is the concentration of molecules in solution. Now, you may have to convert millimolar into milliosmolar or in the reverse direction. And the standard rule is, if you have it in millimolar and you want to convert it into milliosmolar, you multiply by the number of particles you get when you dissolve that molecule in solution. For example, if you're dealing with sodium chloride will dissociate into two individual particles. So if you're dealing with a 200 millimolar sodium chloride solution, this would be equivalent to 400 milliosmolar. You multiply by the number of particles, and here it is 2. Also, you should know the basic reference points for an isotonic solution. Now, an isotonic solution has the same concentration of dissolved particles as you see in body fluids. And the number to memorize here is 300 milliosmolar. An isotonic solution, almost identical to the in vivo situation, is 300 milliosmolar. Now, I know in reality it's only about 285 milliosmolar, but boards or Step 1 tends to round things off, so we memorize 300 as our reference point. Now, you should also realize that this isotonic solution would be equivalent to 150 millimolar sodium chloride. This is also an isotonic solution because sodium chloride dissociates into two particles, and therefore 150 millimolar is equivalent to 300 milliosmolar with sodium chloride. Both solutions are isotonic solutions. They have the same concentration of dissolved sodium chloride. Any dissolved compound that forms an isotonic solution will be 300 milliosmolar. If the compound or particle does not dissociate, then 300 millimolar is equivalent to 300 milliosmolar. Since glucose only forms one particle per molecule, 300 milliosmol and 300 millimolar will both be isotonic solutions. Now, this would be a good way of testing your understanding of these units here, as well as testing some basic physiology. Every once in a while on step 1, they talk about placing red blood cells in a particular electrolyte solution. Now, if they place the red blood cell in 150 millimolar sodium chloride, you have to recognize that that is an isotonic solution and there'll be no change in the red blood cell size. However, if they put the red blood cell in 150 millimolar glucose, you have to recognize that as a hypotonic solution. Since glucose only produces one particle per molecule, 150 millimolar is a hypotonic solution and the red blood cell will swell. Again, those are just questions to test your understanding of units and a few basic physiology points. Now, if we go and consider protein or carrier-mediated transport across membranes, the first point here is the protein carriers in a membrane transport substances that cannot readily diffuse across a membrane. If a substance readily diffuses across a membrane, there will not be a protein carrier for that substance. For example, oxygen and CO2 readily diffuse across membranes. Therefore, there is no such thing as a protein carrier for those gases. You should realize any lipid-soluble substance will readily diffuse across membranes. Now, a good question for step 1 would be to simply ask you, what is the main mechanism by which vitamin D gets across membranes? And your reasoning should be the following. Since vitamin D is a lipid-soluble substance, there is no such thing as a protein transporter for that substance. Those substances readily diffuse across membranes, so the answer is always simple diffusion. Now, with protein or carrier-mediated transport, we have certain basic characteristics that will be applied to any type of protein-mediated transport, and these are listed in your notes. The first one is the substance will be transported more rapidly than diffusion, just for that substance, because that substance does not readily penetrate the membrane. So if a substance does not readily penetrate a membrane, that substance will move faster across the membrane attached to the protein than it will by simple diffusion. I am not saying that protein-mediated transport overall is a faster transport than simple diffusion. I'm simply saying if a substance cannot diffuse across a membrane, it will move faster attached to a protein if one exists in the membrane. Now, a second characteristic that is common to all protein-mediated transport is saturation kinetics. Now, this simply means if you have a substance on one side of the membrane that is carried by a protein, if you increase the concentration of that substance on one side of the membrane, the transport rate will increase initially. But once you saturate the carriers, you should realize you are transporting the substance as fast as you can. And that transport rate with the carrier saturate is called transport maximum. Transport maximum is simply the rate at which you're transporting the substance with all the carriers saturated. And it will be measured in something like milligrams per minute. So at some point when you saturate the carriers, you are transporting that substance as fast as you can. Now, another point that's important here, and we'll be mentioning this later, is that the transport maximum, that maximal transport rate, is proportional to the number of carriers in that system. If you increase the number of functioning carriers, Tm increases. If you decrease the number of carriers in the system, Tm decreases. Now, this would be a very good question for step 1 related to Tm. You are transporting glucose across a skeletal muscle membrane under controlled conditions. If you add more insulin to this medium, what is going to happen to the transport maximum? Now, this should be your thinking in going through this question. Under controlled resting conditions, then, glucose is transported across a skeletal muscle membrane by a protein-mediated transport. If I add additional insulin to the medium, that insulin simply causes more transporters to be placed in that membrane. And because you add more transporters to that membrane, that means that Tm would increase in that system. Now, another general characteristic of protein-mediated transport is that this transport exhibits chemical specificity. A substance must have a certain chemical structure to be transported across the membrane. For example, only the natural isomers tend to be transported by the protein carriers. Therefore, in a particular system, D-glucose will be transported, but L-glucose will not be transported because L-glucose is not a natural isomer. Now again, this would be a very good question related to this point. If they describe the dynamics of glucose transport across a particular membrane system as being the same for both D-glucose and L-glucose, they state that the dynamics of the transport of D-glucose and L-glucose are the same. They can ask you, what is the most likely mechanism transporting glucose across that membrane system? Now, this should be your reasoning. If it was a protein-mediated transport, then the D-glucose would be transported, but the L-glucose would not be transported. Because they have the same dynamics, it cannot be a protein-mediated transport. Therefore, the best answer has to be simple diffusion. If they're transported with the same dynamics, the answer must be simple diffusion. On the other hand, we already alluded to this, if they give you an example where the transport of D-glucose, the dynamics of D-glucose transport were different than the transport of L-glucose across the membrane, then you could conclude that it must be some type of protein-mediated transport. It is not simple diffusion. Again, those are two basic questions to see if you just understood that specific point. Now finally here, in a protein-mediated transport system, there can be competition for the carrier. For example, in vivo, glucose and galactose generally compete for the same transport protein. Therefore then, if you are transporting glucose across a membrane system and you add galactose to the medium, if it is a protein-mediated transport, then the rate of glucose transport should decrease because they compete for the same transport protein. Now, in terms of the types of protein-mediated transport, we divide it into two basic types. The first type is called facilitated transport, sometimes called facilitated diffusion. Now, facilitated transport or facilitated diffusion is an example of a passive process. Now, that word passive is important. If a process is described as a passive process, you have to know that that process does not depend upon cellular metabolism for a source of energy. Passive processes then proceed independent of cellular metabolism. Now, with facilitated transport or facilitated diffusion, the net movement here is always going to be down a concentration gradient. Why? Because with facilitated transport, it is the concentration gradient that is driving the process. This is what this process has in common with simple diffusion. Simple diffusion and facilitated transport are both passive processes driven by concentration gradients. Now, the other type of protein-mediated transport, the other category, is active transport. Now, active transport is an active process. Now, this word active is also important. If a process is referred to as an active process, you should realize that this process depends upon cellular metabolism for a source of energy. So any active process depends upon cellular metabolism for a source of energy. Now, the unique aspect of active transport is that net movement can be, doesn't have to be, but the net movement can be against a concentration gradient. On step one, if they tell you you are moving a substance from a lower concentration compartment to a higher concentration compartment, you are supposed to conclude it must be some type of active transport. No other possibility. This process requires chemical energy, usually in the form of ATP. Now, with active transport, we divide this process into two subcategories. That is primary active transport and secondary active transport. Now, primary active transport is unique in that the transporting protein actually has ATPase activity. So in primary active transport, the actual transporting protein has ATPase activity, so it can utilize directly energy from the ATP molecule. And of course, the most common example given is the sodium-potassium pump. The sodium-potassium pump is a transport protein that has ATPase activity. Another example that we'll talk about later is the calcium pump on the intracellular sarcolemma membrane then. That is also another example of primary active transport. Now, the other subcategory, secondary active transport. The unique aspect here is that in secondary active transport, the transporting protein does not have ATPase activity. So in secondary active transport, that protein in the membrane, and it is actively transporting substances, that protein does not have ATPase activity. An example, the most common example, and it is tested in step one, is the co-transport of sodium and glucose in the renal tubules and the gut. Now, that term co-transport simply means the protein is transporting two different particles in the same direction. So what we have is a protein in the membrane that is transporting sodium and glucose in the same direction. Now, the co-transport of sodium and glucose is illustrated on this figure right here. Now, boards quite often test your understanding of this specific example of secondary active transport. Now, just to orient everyone to this figure, this here is a cell that is lining a kidney tubule. More specifically, this is a cell that is lining the proximal tubule of the kidney. It could also be a cell that is lining the small intestine. Now, this is the lumen of the kidney tubule right here, or the lumen of the small intestine. And because of that, this, of course, is the luminal membrane. Now, this is the blood side, or the interstitial fluid side, and because of that, we refer to this membrane as the basal membrane. Now, the first big point here is, it doesn't matter what example of secondary active transport you are dealing with. Secondary active transport is always powered by the sodium-potassium pump. And in these specific examples, the sodium-potassium pump is on the basal membrane. The sodium-potassium pump is on the basal membrane, and this pump has ATPase activity, and it directly uses ATP as a source of energy. Now, in this instance here, this sodium-potassium pump functions to maintain a very low intracellular sodium concentration. So in this process then, the sodium-potassium pump overall maintains a very low intracellular sodium concentration. Now, if you look at the sodium concentration in the blood or the interstitial fluid, it is very high compared to the intracellular level. If you look at the lumen of the proximal tubule of the kidney or the small intestine, the concentration of sodium here is also high. It's about the same as it is in the interstitial fluid. Now, the secondary active transport of glucose occurs on the luminal membrane. This is where we have that specific protein transporter that co-transports the sodium and glucose across the membrane. Now, the big point here is that this protein is transporting sodium and glucose, and this process is powered by the sodium concentration gradient across the luminal membrane. It is the sodium concentration gradient that is powering this process right here. When sodium in the lumen attaches to this protein, then the sodium is moved down its concentration gradient into the cell. And you should realize it is the concentration gradient of sodium that determines how fast this process will proceed. If you increase the sodium concentration gradient, the transport of sodium speeds up. If you begin to lose your sodium concentration gradient, the process will slow down. And don't forget, the sodium concentration gradient only exists because the sodium-potassium pump maintains a very low intracellular sodium concentration. Now, there's no reason to simply attach a sodium to this protein to transport it into the cell. If you just want to get sodium into the cell, you can simply open a channel. Therefore, you always transport something along with the sodium. And in this case, you transport the glucose along with the sodium. Now, as a result of this movement, the concentration of glucose will build up inside the cell. Therefore, eventually, you are moving glucose from a low concentration compartment to a higher concentration compartment. Therefore, it must be active transport. It is not primary active transport because this protein does not have ATPase activity. The transport of glucose here is secondary to the pumping of sodium by this protein on the basal membrane. It is the pumping of sodium on the basal membrane that supplies the energy for the pumping of glucose on the luminal membrane. Now, the standard questions on step 1 here will go into certain situations that affect the rate of glucose uptake. They will test your understanding about the factors that affect the rate of glucose uptake. And remember, the rate of this process then depends upon the sodium concentration gradient. If you increase the sodium gradient across the luminal membrane, the uptake rate of glucose increases. If you begin to lose the sodium gradient across the membrane, the rate of uptake of glucose slows down. Now, these are reasonable points to test in step 1. They could ask you what happens to the rate of glucose uptake across the luminal membrane if you inhibit the sodium-potassium pump on the basal membrane. And this should be your reasoning to come up with the best answer. If I inhibit the sodium-potassium pump on the basal membrane, the intracellular sodium concentration increases. If the intracellular sodium concentration increases, then the sodium gradient across the luminal membrane decreases. And if that gradient decreases, the rate of uptake of glucose will slow down. They can also ask you questions about the luminal concentration of sodium. You should realize if you increase luminal sodium, you would increase the sodium gradient and the process of glucose uptake increases. On the other hand, if luminal sodium decreases, then you lose your sodium gradient and the uptake of glucose decreases. So this process is stimulated by luminal sodium. It will slow down if luminal sodium decreases. Now, the final big point here is, across the luminal membrane, the uptake of glucose is linked to the uptake of sodium. If they mention that the uptake of something is linked to the uptake of sodium, it is probably secondary active transport. So if the uptake of a particular substance, glucose here, is linked to the uptake of sodium, it is not absolutely required, but it is probably a secondary active transport process. Now, this is the specific example they test in detail on step 1. There is another example in your handout here, the countertransport of sodium and calcium in heart muscle. Now, countertransport simply means that the two different substances or particles are transported in opposite directions. This is another example of secondary active transport, and it will be powered by the sodium-potassium pump. But the membrane system here has completely different labeling. If this is a heart muscle cell, then the cell membrane, all sides will have a sodium-potassium pump. And the sodium-potassium pump will maintain a low intracellular sodium. Now, this is the secondary active transport protein acting in a heart muscle cell. Now, as we said earlier, then, the sodium is always moved down its concentration gradient into the cell. So the low intracellular sodium is driving the inward movement of sodium. And the rate at which it moves in is proportional again to the sodium concentration gradient. Now, in this particular example, the second substance or second particle is transported in the opposite direction. So the inward movement of sodium here is used to pump calcium out of the cell. But again, as I just mentioned, the rate of this process depends upon the sodium concentration gradient. If you lose your sodium concentration gradient, the rate at which you pump calcium out of the cell will decrease. Now, a perfect example where this process slows down is when you give digitalis. If you give digitalis, this drug specifically slows down the sodium-potassium pump. If you slow down the sodium-potassium pump, the intracellular sodium concentration increases. That means you have a smaller sodium gradient across the membrane, and the rate at which you pump calcium out of the cell goes down. Therefore, there is more calcium left in the cell for a more forceful contraction. So the dynamics there are slightly different, but the principles are exactly the same as we taught for the co-transport of glucose and sodium. Now, just to finish up transport processes here, we do need to say a few things about vesicular transport across plasma membranes. Now, endocytosis is, by definition, the active invagination of a cell membrane that brings material from the extracellular environment to the intracellular environment. Now, we divide endocytosis into two separate categories. Phagocytosis is the introduction of solid material into the intracellular compartment, and pinocytosis is simply bringing in a liquid component. We also categorize this based upon the dynamics of the uptake. Constitutive endocytosis is a fairly non-specific, slow process. Receptor-mediated endocytosis involves a receptor. Therefore, it is more specific. But you should also realize it is also more rapid. So receptor-mediated endocytosis involves a receptor. It is more specific, but it is also more rapid than constitutive endocytosis. And finally here, exocytosis is simply the reverse of endocytosis. Now, at the end of the section, you'll see a figure that shows the graphical representation of transport processes. One standard procedure on step one, in physiology in particular, is to throw a graph at you to see if you understand some basic physiological processes. And this is a standard graph that they could give you. The lines can be slightly different, but this is a standard graph to see if you understand the principles of membrane transport. Now, whenever you address a graph, the first thing you should do is to check the axes. Now, the x-axis here is simply labeled extracellular concentration. If that is all they have on this axis, you assume at the origin you're starting at 0 concentration, and the concentration is increasing in this direction right here. Now, the y-axis simply says flux into the cell. Now, you interpret flux into the cell as how fast. Now, I want to emphasize, flux into the cell is how fast the molecules are moving across the membrane. So what is plotted here is the concentration in the extracellular environment versus how fast the molecules are moving across the membrane. And we have 4 different curves then shown on this graph. Underneath this figure in your notes, you have specific questions related to this graph. I won't go through these questions at this point here. If you want to review the material, then simply go through these questions. If you understood membrane transport, you should get these questions correct. Now, the answers with explanations are at the end of this section here, So don't forget to check the answers and the explanations and once you go through this figure. Now that finishes off membrane transport. The second chapter here in the initial section is body compartments. Now this section is much more important for step 1 than chapter 1. There will always be questions related to this material on step 1. They will give you usually 1 or 2 direct questions about this material, and you will have to know this material to answer other questions on step 1. Now the first thing I want to deal with here is the compartmentalization of fluid in vivo. And the first point I want to make is we divide total body water into 2 compartments. One is the intracellular fluid and the other is the extracellular fluid. Now you should have some idea of quantitation here. It's worth remembering about 2/3 of your fluid is inside of cells and about 1/3 of your fluid is in the extracellular compartment. Now the solid line here that separates these 2 compartments is of course the cell membrane. Now we also divide the extracellular fluid into 2 compartments, that is the interstitial fluid and the vascular compartment. Now again here you should have some idea of size, and it is worth remembering that the interstitial fluid contains about 2/3 of the fluid from the extracellular environment, and the vascular compartment contains about 1/3 of the fluid of the extracellular compartment. Now most people have memorized that the vascular compartment has about 5 liters of fluid, and therefore by simply remembering 2/3 versus 1/3 and the vascular volume is about 5 liters, you can figure out very quickly an approximate volume for any of these body compartments. Not that you have to know that specifically for step 1, but you can roughly figure out how many liters of fluid are in a particular compartment. Now, if there is exchange between the interstitial fluid and the vascular compartment, it has to go across this membrane system right here, which of course is the capillary membrane. So just to repeat the membrane systems here, if you're talking about the extracellular fluid versus the intracellular fluid, if you're concerned about exchange between these 2 compartments, then the fluid must move across a cell membrane. On the other hand, if you are considering the movement of fluid from the interstitial compartment or between the interstitial compartment and the vascular compartment, you have to consider a capillary membrane. Now in this chapter here, we're going to focus mainly on the distribution of fluid between the extracellular and the intracellular compartment. And to understand these type questions, you have to know exactly the important characteristics. You must fully understand all details about the general characteristics of a cell membrane. Now the first characteristic that's important here, and I'm sure it's an obvious one, but cell membranes in general are freely permeable to water. That means in a steady state situation, and this is tested on step 1, in a steady state situation, the concentration of water inside of cells is the same as the concentration outside of cells. So in a steady state situation, the intracellular concentration of water is the same as the extracellular concentration of water. Now earlier we mentioned that in an isotonic normal situation, the osmolarity of body fluids is normally 300. That's our reference point. Now if the extracellular fluid is 300 and you are in a steady state situation, it means the intracellular osmolarity is 300. A bottom line point is In a steady state situation, the extracellular osmolarity is always going to equal the intracellular osmolarity, because in a steady state situation, the extracellular water concentration and the intracellular water concentration will be the same. Now, the second very important characteristic of a cell membrane is these are basically impermeable to sodium. More general than, they are impermeable to sodium chloride. Now, boards won't test it specifically this way, but when you're dealing with osmolarity of a particular compartment, you're usually dealing with something called effective osmolarity. So when I said this compartment has an osmolarity of 300, what I really mean is this is the effective osmolarity of this compartment. Now, this is the important point. The effective osmolarity of the compartment is what you have to deal with if you're considering water movement across a membrane that separates that from another compartment. So if you're considering water movement across a membrane, then you are only considering the effective osmolarity in the two compartments. And the effective osmolarity is only determined by dissolved substances that cannot penetrate the membrane you're considering. So just to repeat that then, if you're considering the osmotic movement of water across a membrane, you only consider the effective osmolarity of the two compartments, which is the concentration of non-permeable particles. Now, in the extracellular fluid, most of the particles in that fluid that cannot penetrate a cell membrane then are represented by sodium chloride. So most of the effective osmolarity of the extracellular compartment is determined by the concentration of sodium chloride in the extracellular fluid. Taking it one step further, you should realize that 2 times the sodium concentration in the extracellular fluid is a good index of body osmolarity. So 2 times the sodium concentration of the extracellular fluid gives you usually a good index of body osmolarity. For example, if they told you the sodium concentration in the extracellular fluid was 140 millimolar, then the extracellular osmolarity would be very close to 280 milliosmoles. So 2 times the sodium concentration gives you a good index of body osmolarity in terms of milliosmolar. Now, the big challenge here is to understand the consequences if the effective osmolarity changes in the extracellular compartment. Now, it's just the bottom line points that are important here, but you should follow this reasoning. Now, if we're considering the osmotic movement of water between the extracellular fluid and the intracellular fluid, we have to focus on the extracellular fluid effective osmolarity, which is mainly sodium chloride. Now, this should be your understanding. If the salt concentration in the extracellular compartment increases, if the sodium concentration increases in the extracellular fluid, the water concentration decreases in the extracellular fluid. If that is the case, you now have a higher concentration of water inside of cells, and therefore the water will flow from the intracellular compartment to the extracellular compartment, which means the intracellular environment gets smaller. Now, you should understand the reasoning there, but you should memorize and have at your fingertips. If extracellular osmolarity increases, cells always shrink. So if extracellular effective osmolarity increases, cells will shrink. Now, if we consider the reverse situation, suppose in the extracellular fluid, the sodium chloride concentration goes down. So if the sodium chloride concentration decreases, you should realize the water concentration in the extracellular compartment increases. So as sodium chloride concentration decreases here, then the water concentration increases. Now, if this occurs, you end up with a higher water concentration in this compartment than inside cells. So what happens is the water will flow into cells and the intracellular fluid volume will increase. Now, you should have understood the reasoning there, but again, you have to have the bottom line point at your fingertips. That is, if extracellular osmolarity decreases, your cells swell. The bottom line to memorize and have at your fingertips is the following. If extracellular osmolarity increases, your cells will shrink. If extracellular osmolarity decreases, your cells will swell. That is so important. You should memorize those statements, and you should not have to think through point by point to the conclusions there. Now finally, and we're not going to address the details here, but the principle is worth introducing. If you are considering the osmotic movement of water between the vascular compartment and the interstitial compartment, then you must pass across a capillary membrane. And all you consider in terms of osmotic movement of water will be the solutes that cannot penetrate the membrane system you are considering. Now, sodium chloride then readily penetrates capillary membranes. So sodium chloride does not contribute to the effective osmolarity of the vascular compartment or the interstitial fluid compartment when you're thinking about the osmotic movement of water across a capillary membrane. The only natural substance that cannot penetrate a capillary membrane is protein. Therefore, when you are considering the osmotic movement of water across a capillary membrane, then you are considering the effective osmolarity of the vascular compartment, which is determined by the concentration of proteins in this compartment, and the effective osmolarity of the interstitium, which is determined by the concentration of protein. So across the capillary membrane, then, you're considering the concentration of proteins on the two sides, but when you're considering the osmotic movement across the cell membrane, you are considering the concentration of sodium in the extracellular fluid.